The POSH test is the posterior shear test. This is, for all intensive purposes, very similar to, if you remember last semester, the scour or the femoral grind test, with a slight modification. And we even talked about this when we were kind of talking about the hip last semester. What I'm going to do is basically I'm going to bring this patient into a position where their hip is flexed, abducted, and externally rotated. So they're kind of in this flexed, abducted, and externally rotated position. So right about here. And what I'm simply doing is I'm applying long axis force through his femur. So I'm applying compressive forces down the long axis of his femur. Okay? Now if you remember the hip scour test or the femoral grind, I'm kind of moving it around and I'm applying axial compression, but I'm moving into various positions. We even talked about maybe even catching the labrum with that or whatever. In this one in particular, what we believe is happening is that in this unique position of abduction, ER, and flexion, is as I elicit force in that specific position, we're kind of going and we're eliciting force through the hip. I engage the hip compresses, and then I'm taking that pelvis on that side, and now I'm compressing the SI joint. So it's an SI compression kind of test, and I'm doing it through the femur. So it's very similar to the femoral grind or the scour. The only difference is I'm not scouring. I'm not doing this. I'm just bringing him up into this static position. A lot of times I'll put his knee on my chest like this, and I'll just kind of push in like this. Now, I may be slightly off position, so I might move it up a little bit or down a little bit. If I'm slightly off of that position, I'm not right there, I may misinterpret this test. So I might move it around a little bit, and I'm just eliciting force through there. And what some of the evidence seems to show, even though it's not great, and you can see the sensitivity and specificity of all these tests there, as I'm doing this, what the thought is that in that unique position, I'm eliciting force through that SI joint. If it's inflamed, irritated, problematic, it's going to reproduce the pain. So again, positive test, reproduction of pain. That's the posterior shear, also known as the POSH test.